All right, we'll give it a few seconds for people to pop in. I'm going to go ahead and come over here and just make sure that we are all good to go. All right, wonderful. We will go ahead and get started. So thank you everyone for joining us here at our Network Health Facebook Live on March 17th. My name is Chelsea, and we are joined here by our Manager of Pharmacy Benefits, Andy Wheaton. Here at Network Health, it's really important for us to be able to share this critical COVID-19 vaccine distribution information with our community to help keep them safe and healthy. Before we get into it and let Andy introduce himself, I would like to just address a couple of housekeeping. So if you have any questions at all during this live, please go ahead and drop them in the comments, and we will get to them after we address all of our updates for the week. And then Kelly will also be in the comments section dropping any important links. She's with Network Health as well. She's going to be dropping any links and phone numbers and any other relevant info that you guys need. So we'll go ahead and hand it over to Andy and let him tell us why he is our COVID-19 vaccine expert here at Network Health.
Just want to do a quick sound check. Make sure you can hear me.
Whoop. Oh no.
Are you able to hear me? All right, there we go. So just wanted to say hi. My name is Andy. I'm a pharmacist and the pharmacy manager here at Network Health. This past fall, I co-led our Medicare flu vaccine initiatives on our Medicare line of business. And now it's our turn for the COVID-19 vaccine. And so I'm here just looking to share some information, the latest updates that occurred over the past week. So happy to do that, and look forward to hearing any questions that you may have.
Awesome. Thank you, Andy. So let's go ahead and get into things. So we got a lot of updates this week. We've heard a lot of news around Group 1C. Can you go ahead and tell us a little bit more about that and what it means?
Yeah, so this was the big news this past week. So the phase 1C is, we've eagerly been waiting for this information. So originally we heard that this was going to be updated for March 29th. But late yesterday, we actually heard that Governor Evers moved it up to March 22nd. So beginning on March 22nd, individuals that are age 16 and older that have certain medical conditions that are at greater risk for severe COVID-19 infections will be eligible. So please note this date was moved up again from Governor Evers in an effort to just get more vaccines in our Wisconsinites' arms. So I believe Kelly was going to share the eligibility or the eligible population, but just to highlight a couple of them. So people that have asthma, diabetes, hypertension, so high blood pressure, obesity or overweight, so a BMI of 25 now qualifies you as an eligible recipient for the vaccine. So keep that in mind as you start to think about, okay, I'm starting to become eligible on that March 22nd date. What do I need to do? Who do I need to register with? And we'll get more into that in a little bit, but just wanted to provide this update. This is a large group in the state of Wisconsin. It's estimated that about 2 million people are now eligible as of the 22nd of March.
Wow, that's a lot. And for any of us who run away, the calendar runs away, that is this coming Monday. So that's very soon. So that is good to know. We've also seen some other updates around some new clinic sites. So specifically, can you tell us a little bit more about the announcement of Lambeau Field becoming a vaccine clinic?
Absolutely. So what this really means is Wisconsinites have more choices and locations to get the vaccine with this initiative ramping up. So this one's in partnership with Bellin, the Packers, and then Brown County. They're rolling out it at Lambeau Field, and that, I believe it starts today. They're going to do the vaccines in the atrium. And they're looking to do about 6,000 vaccinations per week, and their hope is with supply as that increases, they want to get to about 10,000 doses a week, which is unbelievable and it's fantastic.
Yeah.
What I'm understanding is you need an appointment. You can't just do a walk-in, so make sure you can keep that in mind. I do have a phone number available for this. It's 920-445-7313. And then what I also understand is Bell and Health, they're allowing eligible members to sign up on their vaccine website as well. So bellandhealth.com, they'll be able to sign up for the Lambeau Field initiative as well.
Wonderful. And we'll have that link and phone number in the comments section below here as well. And then for the Milwaukee area, we've heard about the Wisconsin Center. Can you tell us some of the updates around the Wisconsin Center for Milwaukee area?
Yeah, another great initiative down in Southeast Wisconsin. So anybody in the Milwaukee location, this is for you. The disaster team through FEMA called Team Rubicon is helping at the Wisconsin Center. So they're kind of taking over this initiative. They started on the 15th, so Monday, and they plan to do about 2,000 doses per day, which is unbelievable. Again, this is fantastic news. Since it went to FEMA oversight, you no longer need to live or work in the Milwaukee area. So that opens up the eligibility population. Another initiative that allows to happen is those people that would normally be stationed at this site that are work and live in Wisconsin, they can now go out to more mobile vaccination sites. So that increases the area that are eligible, and the population that they're able to target is expanding as well. So this is fantastic news for the state.
Wonderful. More doses and more people to give out those doses in the area. That's fantastic. I think one thing maybe to clarify too, I've seen a little confusion of now that the Wisconsin Center is open, you still need to be within the current eligibility criteria, correct?
Correct. Yep.
Okay, awesome. Let's see, what other questions do we have here? So with these more of these clinics opening up and more of the vaccines being available, how do people go about scheduling and making sure they get an appointment if they are now eligible?
Absolutely. So the big question is, now that I'm eligible, how do I sign up? I really would encourage you to go to our Network Health website. We have an interactive map of the state of Wisconsin. It links to the Department of Health services for the state, and it's updated on a weekly basis. So if a vaccination site comes online, it'll be eligible. It'll show up on this interactive map. So you'll be able to click on there. If it has a link involved, you'll be able to link up to the website and get signed up for the vaccine. If there's a phone number involved, you can also see that there. The state also provided a 1-800 number that if you don't have access to a computer, or you know somebody that doesn't have access to a computer that is interested in getting a vaccine, you can also direct them to this phone number. And I'll give that to you. I believe Kelly's going to put that in the chat box, but it's 1-844-684-1064. I just want to point out one other thing, that most pharmacies or clinics may not update their website for the eligible population until the date they are eligible. So don't be surprised if you click on there, if you signed up today and you're going to be eligible on the 22nd, it may not show up quite yet. Don't be discouraged, just keep trying. Just want to make sure everybody's kind of aware of that and kind of the process that some of the clinics and vaccination sites use for this update.
Absolutely. Important to know that while you're going to be eligible starting next week, there may still be some time before you can get scheduled in, and to check back next week once they get more doses. So I'm going to go ahead. I've got some questions that were asked ahead of time. If anyone has questions, feel free to drop them in the chat right now, and we'll get to them very soon. But a question that I got earlier was regarding children being vaccine trials going for younger kids now. Can you tell us a little bit more about those trials and kind of how those are going?
Yeah, so the Moderna vaccine is the one that's being really looked at right now. So we heard initially those that are 12 and older, were starting to get involved with the trial, and I believe that that's been going on for now a month or so. Recently, we heard that those children that are 6 months to 12 years of age are actually getting included into these trials as well. So as we hear more about these trials and kind of the effectiveness of the vaccine and what to expect, we'll definitely relay that information during this initiative, as well as on our website, and make sure that everybody's aware of what's happening with the latest COVID vaccines.
Absolutely, good to know. So I'm going to go ahead and go over here and check for any questions. Not seeing any coming through yet, but we'll give it a couple minutes before we sign off here, just for any questions that might have come up.
Yeah, one thing I just wanted to remind everybody about, we're hearing about some fraud that's occurring with the COVID vaccines, and then people trying to, basically get some sort of fee involved with signing you up for the vaccine, or taking your personal information to get signed up for the vaccine that's not connected with one of these vaccination sites. I want to assure everybody the vaccine should not cost any money. The vaccine or the administration fee should be no charge wherever you go. So if you're being asked to provide some of this information, being asked to provide a cost or a fee and some other information, please don't do that. Contact us. We'll work with state officials to make sure that we're following up appropriately. But just wanted to point that out. That's very important, and wanted to make sure that everybody's aware.
Absolutely. Yeah. And another reason to head to our website for the official resources and official places that you can get signed up for the vaccine as well. Wonderful. Well, I am not seeing any questions today, which is all right. I feel like we had a lot of updates today for everyone. So Andy, do you have any parting thoughts before we sign off here?
I think the only thing we touched on it last week a little bit about what does it mean to be fully vaccinated. So I just want to make sure everybody's aware that really means if you have the 2-dose regimen, so if you're on the Pfizer or the Moderna, if you're getting the Moderna one, that means 14 days after that second dose, that means you're fully vaccinated. If you're on the Johnson & Johnson regimen and you just get the single dose, that's 14 days after that single dose. So just want to make sure everybody's aware of that. The CDC is constantly updating their guidelines as to what it means after you're fully vaccinated, who you can visit with. We're going to probably hear more about that within the next week or so, which is great. So they'll provide some of that guidance as well. So more to come, but just wanted to make sure everybody's aware, what does it really mean to be fully vaccinated?
Absolutely. Thank you, Andy. Thank you for everyone for joining us this week. We will be back here next week, Wednesday at 1:15 again to share the latest updates on the COVID-19 vaccine distribution here in Wisconsin. Thank you so much. Bye.
Thank you.